Flu season is in full swing here in the United States, and it is hitting particularly hard. According to recent data from the CDC, ending the week of February 1st, 43 states as well as Washington, D.C. are reporting high or very high flu activity. Additionally, so far this season, there have been 24 million reported cases, over 300,000 hospitalizations, and 13,000 deaths. And joining us now with more on this very active flu season and what you need to know is Dr. William Schaffner, professor of medicine in infectious diseases at Vanderbilt University. Dr. Schaffner, good to be with you today. It really seems like influenza is really running rampant right now, but how does this flu season compare to others?
Well, Tracy, it's wintertime, right? And that's the time when flu has its annual outbreak. Some of them are milder, some of them are more severe. And this year's flu season seems to be on the more severe end of the spectrum. As you have just said, there are oodles of cases. Emergency rooms and hospitals are full of people with influenza and its complications. And that's very unsettling, unfortunate, but it's what we can do. Most of the people who are in the hospital today, because they have severe flu, unfortunately, didn't get their vaccine. And so let's all make a resolution this fall, when we're preparing for the next flu season, let's all get vaccinated. That vaccine helps keep us out of the hospital. It can't prevent every case of the flu, but it helps prevent the most serious aspects of influenza.
Absolutely, it certainly does. And doctor, what do you think is contributing to these high flu levels this year, and what strain is most prevalent right now?
Well, we're having two influenza A strains, not to get too wonky about this, but the A H1N1 and the A H3N2. Both of these strains are out there and causing most of the influenza. They're hitting people who are unvaccinated, and of course, always older persons who have underlying chronic medical conditions, people who are immune compromised. All those folks, whether vaccinated or not, if they go out today to indoor activities with a lot of other people, even to the supermarket, put your mask back on. It's another layer of protection, and they may want to think about streaming the movie rather than going to the movie.
Well, let me ask you this. There's so many things floating around now that we know, a lot of different types of viruses. How can you tell if it's a seasonal flu compared to COVID or maybe something else?
Well, that's a very good question, and you often cannot. And that's why testing is so important, particularly for those people who are in those high-risk groups that I mentioned, because if you have flu or if you have COVID, we have medicines, different medicines, that can treat those. So if you're in a high-risk group, contact that healthcare provider very, very quickly, because you may well get tested and can get treatment for whichever kind of viral illness you happen to have.
Yeah, and it's very important to get that under control. We know that. We've also been hearing a lot about the bird flu. What's the latest with that, and should we be concerned?
Well, be interested for sure, but cross your fingers. At the moment, bird flu has not acquired the capacity to spread readily from person to person. It's out there in poultry flocks. That's why the egg prices are going up. It's out there in dairy cattle, but pasteurization actually kills the virus. So we're in good shape there so far. The risk of bird flu to the average person is teeny tiny. At the moment, the risk of seasonal flu is very high, however.
Absolutely. A lot of us know that personally. Dr. Schaffner, thank you so much for being with us and all your great advice. We appreciate it.
My pleasure. Thank you.